My topic is meningitis. Meningitis is an inflammation of the membranes, meninges, surrounding your brain and spinal cord, usually due to infection. The arachnoid mater and the pia mater are the most affected, and the inflammatory changes in the central nervous system cause the morbidity and the mortality, not the infection, actually. But we know that the meninges surround the brain and are around the spinal cord all the way down to the base of the spinal cord, the spine, excuse me. There are 5 types of meningitis. We start here with the viral meningitis, which is caused by viruses like the enterovirus, the arboviruses, and the herpes simplex virus. Then we have fungal meningitis, which is caused by fungi like the Cryptococcus and the Histoplasma. Parasitic meningitis, which can be in your food or water and soil. And then we have non-infectious meningitis, which is caused by cancers, systemic lupus, methylomatosis, certain drugs, head injury, and brain surgery. And here at the top, they have the bacterial meningitis, which is caused by the Neisseria meningitidis and the Streptococcus pneumoniae, which is the most prominent one, the bacterial. So we have here different age groups and see which of the meningitis affect them the most. And we see with that the Streptococcus pneumoniae and the Neisseria meningitis, or the meningococcus meningitis, are in most age groups, and that they are actually a cause of 80% of all cases. We will speak mostly about the meningococcal meningitis due to its high prevalence. Meningococcal meningitis is contagious. It's spread by respiratory secretions. And the interesting fact is that 1 in 10 people are carriers of the meningococcal bacteria in their nose and mouth with no symptoms. Kind of a, Typhoid Mary of our current age. Typhoid Mary had typhoid, but she never had the symptoms, but she gave it to everybody. So they kept her isolated. So, this is a similar case with the meningococcal bacteria. So who is at risk? Anyone at any age can get meningococcal disease, but some people have a higher risk for the disease. Infants less than 1 year old, people living in crowded settings like college dorms and military barracks, people with immunocompromised state, no spleen, or have sickle cell anemia, people traveling to certain areas outside the United States, such as the meningitis belt in Africa, which is about like where Senegal is, and you just go east, and there's a fairly large belt all the way across it. Evidently, it's very prevalent there. Laboratory personnel who are routinely exposed to meningococcal bacteria, those who might have been exposed to meningococcal disease during an outbreak at one point. Adolescents and young adults, these are the ones that we find that are living in crowded situations like dormitories, boarding schools, and maybe sleepaway camps. Attendance at a new school with students from geographically diverse areas. We don't know who brought it in. Irregular sleeping patterns, active or passive smoking, social situations where there is crowding, and moving to a new residence. So the characteristics of meningitis is a fever of greater than 100.4 caused by the endogenous cytokines released during the immune response. Stiff neck, so traction on the inflamed meninges causes pain, limiting range of motion, which gives you that feeling of stiff neck. Changed mental state, there's an increased intracranial pressure that causes brain herniation that can lead to injury of the reticular formation that controls consciousness. Neurological deficits, cytotoxin edema, and increased intracranial pressure that injures the neurons in the brain, with sight damage depending on the affected region of the brain. Seizures is inflammation in the brain, decreases the seizure threshold in the brain. Headaches are caused by bacterial exotoxins, cytokines, and increased intracranial pressure that stimulate the nociceptors in the meninges. The brain itself has no pain receptors, so that's not where the headache originates. It's the nociceptors. And shaking of the head will intensify this pain. Photophobia, which means light sensitivity to the eyes, is related to meningeal irritation and thought to involve the trigeminal nerve. Nausea and vomiting occurs due to increased intracranial pressure that affects the area postrema, which is the vomiting center of the brain. And then the petechia rash that occurs in meningitis cases caused by the N. meningitis bacteria. So here is a picture of the signs and symptoms. Here you can see on his stomach is the petechia rash, but it can be anywhere. It can be on the arms, the back, the neck, anywhere. So for young children less than 2 years, because the sutures in their skull have not closed, they can have bulging fontanelles, which is due to increased intracranial pressure that pushes the meninges through the spaces in the immature skull. Children may have jaundice, which is irregular bilirubin excretion, possibly due to sepsis. And then, of course, they have decreased appetite, irritability, lethargy, and toxic appearance. So here's a poster for children, awareness for children. An interesting fact here, because children cannot tell you that their neck is stiff or hurting, what you would be looking for is that if they screamed when you went to pick them up, if they had some traction in their neck, or that they moaned, did kind of a moaning cry, because they may not be truly alert at this point. So the petechia rash doesn't blanch, so you can see here, you can still see the red. If it was something else you could push against it, it would probably turn white. So that was a way you can kind of test it. So as you can see, between meningitis, the cold, and the flu, there's not a whole lot of difference. So that's why it's so often misdiagnosed early on, and the disease actually progresses before they realize what's going on. I had a friend that actually developed from a sinus infection, a bacterial infection, and the doctor just gave him medicine for a headache, and he was in the hospital 2 or 3 days later with full-blown meningitis, and to this day he has seizures. Incidence rates. Approximately 600 to 1,000 people contract meningococcal disease in the U.S. each year. Of those who get meningococcal disease, 10 to 15% die. Among those who survive, approximately 1 in 5 live with permanent disabilities such as brain damage, hearing loss, loss of kidney function, or limb amputations. 21% of all meningococcal disease cases occur in preteens, teens, and young adults ages 11 through 24. 1 in 5 U.S. teens have not yet received their first dose of the meningococcal vaccination against the serogroups A, C, W, and Y, and remain unprotected. Less than 1/3 of those first dose recipients have received the recommended booster dose. Many teens have not received the meningococcal serogroup B vaccine since it was just permissively recommended by the CDC in 2015. Method of diagnosis. They do a lumbar puncture, and from the spinal fluid, they do some testing, and the gram stain is done to kind of isolate what type of agent, what bacteria basically, is involved, and if they don't find a bacteria, then they generally list it as viral. White blood cell count will be between 1,000 and 10,000. The spinal fluid glucose level will be reduced and often extremely low. The causal agents of the bacteria or fungal meningitis reflect increased protein levels. So they will also use this lumbar puncture in order to figure out what the intracranial pressure is. Treatment. Timing is everything. The sooner the treatment starts, the better the recovery. However, early treatment does not guarantee survival. Objectives of the treatment will be, one, to reduce the intracranial pressure, and they do this by elevating the head, hyperventilation, and controlling the seizures. They also want to destroy the pathogen. If it's bacterial, they will try to find the bacteria that are the antibiotics specific for the bacteria so that they can address that. The thing is they will actually start treatment with heavy treatment of antibiotics while they're still trying to figure out exactly what the particular pathogen is, because they really know that timing is everything and they need to fight the infection as quickly as possible to get the inflammation down in the brain and to decrease injury. Antiviral therapy will be given to patients with the herpes simplex virus. For the Streptococcus pneumonia meningitis, they will try to reduce the inflammation using corticosteroids. However, the best treatment is prevention. Prompt treatment of all illnesses, especially illnesses that occur close to the brain, like sinusitis, mastoiditis, ear infections, and then pneumonia. And then here is a list of the vaccines that are currently available to prevent infection. Prognosis. Viral meningitis is usually mild and generally clears with minimal intervention. Fungal meningitis causes chronic meningitis, which is you get a reoccurring illness that has to be treated periodically and can cause death if not treated with an antifungal medication. Bacterial meningitis, even early treatment does not guarantee survival or prevent cognitive or physical injury. The majority of damage to the body is due to the immune response, including but not limited to brain damage, developmental delays in children with decreased verbal and decreased performance IQ. You have hearing loss, vision loss, loss of kidney function, and limb amputations, just to name a few. Anne Geddes, actually, in England, did pictures for the Meningitis Society there in order to do an awareness to get people to get their children immunized. And these were the shots that she took. And by the way, this young man is actually a teen athlete at this point in his life. And here are my references. Thank you.